World-renowned orthopedic surgeon Dr. Richard Berger is known for his minimally invasive hip and knee replacement that doesn't cut muscles, ligaments, or tendons, giving you a quick and effective recovery. When environmental artist and author Margot McMahon needed hip surgery to get back to doing what she loved, she knew who to call. I spoke to them both to find out how he got her back on her feet. Athletes, celebrities, artists seek you out for your specialties with your hip and knee replacement surgical abilities and capabilities. Tell us a little bit about your procedure and why it is in such high demand.
What I do is minimally invasive surgery. That's hip and knee replacements without cutting the muscles, ligaments, or tendons, with a bunch of instruments and techniques that I devised. So that allows you to recover faster, less pain, easier therapy, and most importantly, more completely. So you get back to the joint you had many years before and can do all the things you want.
Well, the word is out because Margot came to find you specifically because you had a specific timeline that you were on.
Yes, I had already selected a group of sculptors from the nation to come in to Ragdale Foundation and sculpt the tree, a grand old elm that was saved for many, many years, but it was finally at its last leg. So we were all coming together in May to sculpt this tree, but I had a hip that didn't work any longer.
Oh, it came to a
So
point
I knew who to call, Dr. Berger, right away.
And so when you talked to him, you said, hey, I have this tight timeline. I need to get it done. Dr. Berger, were you able to meet that deadline?
Of course. We're here to help. We're here to help, no matter what. So people come to me, they want a quick recovery, they want to get back to their life, whether they want to get back to sculpting trees or running triathlons or just taking a dog for a walk. I want to do that for them quickly.
And you had your surgery when?
March 5th.
And you were up in some heavy equipment by what?
Well,
May?
we were carving the tree by Memorial Day.
Okay.
We were carving the tree by Memorial Day, and we worked May through June for sculpting this tree.
How did it feel climbing in and out of the heavy equipment, doing all the work you needed to do in order to achieve this feat of carving the tree?
So my concern, of course, going into a scaffold with a chainsaw, even with the gear, was balance. And I took from the moment of getting out of surgery to the middle of May, going to physical therapy 2 or 3 times a week to make sure that I had the balance for it. That was my biggest concern. I will say, as soon as I woke up from surgery, I felt no pain, and I had kind of forgotten what it was like to go through a day without pain.
Wow.
And I was already walking up and down the stairs within an hour of surgery, and I was out the door and home by 3:30.
That afternoon.
Yeah.
And that's another thing that people should know with hip and knee replacement is no longer that long hospital stay.
Yeah, with minimally invasive surgery, patients just recover quicker. So we allow them to leave the hospital. In fact, we do it at lots of surgery centers the same day. Margot came in walking with walking sticks, couldn't get out of bed, couldn't do anything without walking sticks. A couple hours later, she's up and walking with no pain, with no walking sticks.
Oh my goodness. And how long have you pioneered this procedure?
I started doing this about over 20 years ago, and I've been lucky enough to help thousands, in fact, about 25,000 patients do outpatient hip and knee replacements now.
So you have it down to a science.
I have it down to a very exact science.
Or possibly down to an art. That's even
Well,
the
there
harder.
you go, an art. Margot, what would you say to someone out there who's now listening to your story saying, I don't know, shouldn't I can I go a little bit longer on this hip or this knee? What do you say?
Well, the first thing is I could not be more delighted to tell people to call Dr. Berger. And he scheduled me early. But also, I would say go early rather than later because your hip or knee is hurting. And that's going to affect every other joint and your balance. And that's when you get injured, is when you're kind of taking care of one joint and the others get overworked. So I would say go early and go early again if you have to.
Okay. Well, and also I imagine it's about getting back to a quality of life.
Getting back to quality of life. Most people wait too long. They come back at a week or 2 or 3 and say, why did I wait so long? Thank you for my life back. People are afraid of having surgery, and they shouldn't be. With this minimally invasive surgery, There's very little pain, very little downtime, and you can take your life back.
Dr. Berger, some people are not in a position that they can actually come in and see you, and you offer a telehealth option?
We do. It's called the BEST procedure. It stands for Berger Elective Surgery with Telemedicine. And we can see you in the office or we can see you on the computer. We can schedule everything, see you whether you need surgery, what to do about it, and do everything prior to surgery. So you'll have to come and see us to get the surgery.
Yes.
But we can do everything before and then everything after. You can do convenience of your own home.
That's amazing. All right, to make an appointment or to find out more about Berger Elective Surgical and Telemedicine, visit outpatienthipandknee.com, or you can call the number on your screen. You can also follow Dr. Richard Berger on social media. His handles are also there on your screen.